Now, what if you have bad gums, like bleeding gums, bad breath, loose teeth, gum disease?
Yes,
Can you
lots of
still
people
get
out there.
implants? Like you can't save those teeth.
Yes, yes. Now you have to do it the right way so that it works, because implants can also get gum disease. But what we have to do is we just got to clean it up. What we do is and sometimes we have to stage it, whatever the patient needs. But we take the teeth out, we clean it up, we might do some grafting. But even often with patients, if we take all the teeth out, the teeth are what holds the gum disease in.
Okay.
So with the removal, with the extractions, we now can eliminate all those bacteria, and we can place implants into healthy bone, and there's always some healthy bone there somewhere, and we can augment. And then we give them implants, and then we give them teeth on top of that. And again, there are different options, right? So you could have a couple of implants that you snap in and out, a denture that's still removable. That's right,
okay.
That's right. And it really stabilizes it tremendously. See, if you take somebody like me with all their teeth, and I have 100% chewing function, if you now take all the teeth and you give me upper and lower dentures, I have now 15, not 50, 15% of the chewing function I had before. So really think about that. You can't really grind anything. Now, if we take some implants, whether it's 2 or 4, and hook the denture in, you're going to be in the 70s, 80s percentile.
Now you can eat salads or whatever.
It's a huge jump from 15%, right? And so they snap in and out. You can still remove your teeth, but they're very stable. They don't move around anymore. You can chew on one side without the other side popping up. You can bite into things and have a much better chewing quality.
So even if you have bad gums, though, they're not more likely to fall out, these implants?
No, not if we do it. We got to clear up the gum disease. We got to go through the right steps. But they can absolutely still get dental implants. I often see patients who have gum disease. That's why they're losing the teeth. Most dental implant patients have a history of gum disease. There are very few that don't. And so those are their options. They still even have the option of getting teeth that don't come out.
Yeah, tell me about that.
Yeah,
okay, so these are people you had to remove all their teeth. They did not want a denture. That's why they came to you. I interrupted, so go ahead.
No, that's fine. They didn't want a denture. And so what we do is we take the teeth out, we clean everything out, we put some antimicrobial solution around there, place the implants, and then we often same day procedure, we take some fake teeth and hook them up as a bridge. So we make them a bridge on the implants, and they come in with their failing teeth and they come out with fixed implant bridge work. That's a technical term, but teeth that don't come out. Okay. And it's just one day. And if lots of patients decide to get sedated for this, so they just come in, fall asleep, and wake up, and they're going home, and they have teeth, and they have a new smile. And it really wakes them up when they get that mirror, and there they are, and all of a sudden there's a new smile, there's a new you. It's fun to watch.
Now, you have this method or this approach that most offices, you go to one place, the surgeon that does the surgery, another office that does the x-rays or the CT scan, then another place that put the teeth on top. You do it all right there.
We do it all right there.
What's the big advantage of that? I mean, other than convenience, I guess.
Oh, it's very convenient. You don't have to have multiple providers, and God forbid something goes wrong and everybody's pointing their finger at the other person. Not that things go wrong usually, but it's nice to have one provider who really follows you start to finish and then continues to monitor, because you're not done when the teeth are delivered. You are going to have to maintain them for the rest of your life. And so what we do is we follow the patient with their cleanings and make sure the bite is good long term. Every year you should really have somebody look at your bite and take x-rays, make sure everything's looking good. And so we follow them for however long they're in town to be followed for.
So when they get their new set of teeth, they're like back in the system, they're coming in for cleanings like every 6 months, things like that?
Yes, and it's this misconception that people who have dentures shouldn't go to the dentist at all, right? Lots of people who have dentures don't go, and they wonder why their dentures might get looser and looser, because even people who don't have teeth need the dentist, because you may need a reline, or you may not even know that you have options beyond the normal denture. You may not even be aware what we have available.
So no more dentures?
No more dentures if you don't want to.
Do you think that's the future of dentistry, that whether it's 20 years or 100 years, dentures as we know them today, not attach anything, will be gone? They'll all be attached.
Eventually, I believe so, because people just won't go for it anymore. We used to not have any options. I don't know if you ever saw Washington's teeth. They were like
George Washington.
George Washington. There was like wood and some ivory. They're all in the dental textbooks, and he had springs between to try and make them open up, and he was miserable. Now we have regular dentures, and I think a couple decades from now, the generation that's now young will not tolerate and some of them are going to lose their teeth. We're getting older.
Yeah.
Some people just have bad genetics for teeth, and even though they brush and floss every day, they do everything they're supposed to, they always go to the dentist as they're supposed to, over time they just go bad.
How old can you be to do this?
Oh, there's no limit. You can be too young. If you're still growing, you can't get implants yet because they'll end up in the wrong place. But you can't be too old.
Like
you
an
can't
80-year-old
be too
can
old.
do this?
Absolutely. It's about your health, right? So if you're generally healthy or well managed, even if you have high blood pressure or diabetes, if you're well managed, we can most certainly do this procedure.
What's your oldest patient?
Oh, I want to say somewhere in the high 90s.
Is that right?
Yes.
Why would a 90-year-old want to do this?
For quality of life.
To eat,
you know, you want to eat, right?
Okay.
You want to enjoy your foods no matter how old you are. And even if it means that for the last 5 or 10 years of your life, you don't have to worry about your denture popping out as you're talking, and you can just eat the foods that you really want to eat, and you can smile with confidence. That's so worth it. Why wouldn't we want to do it? You can't take the money with you, but you can really enjoy the last few years of your life better. Absolutely. And they heal well too. People think that if you're older, you don't heal well anymore, but I don't see that.